I'm joined in the studio now by Professor Charles Deacon, who is a consultant anaesthetist and the medical director for South Central Ambulance Service, which is one of the partners involved in all of this. Tell us first, what can a doctor do that a paramedic can't?
Absolutely. Well, doctors enhance the delivery of clinical care by providing additional skills on scene for these seriously ill patients that wouldn't otherwise be available until the patient reached hospital. So in the first few minutes after a serious injury, it's been termed the golden hour, which you may be familiar with, and the critical care treatment that we provide to the patient then can make a huge difference in terms of their outcome.
So more complicated procedures being carried out sooner, obviously of benefit to the patients.
Absolutely. Normally what would happen is that the paramedics would stabilise the patient on scene and then take them to the hospital where these additional procedures could be started. But by having a doctor on board, we can begin these critical care procedures on scene rather than in the actual hospital in the emergency department. And by doing that, it's been shown that we can make a big difference to patients, both in terms of their survival but also their longer-term disability.
We heard in Joe's report there it's going to cost a significant sum. Is it sustainable in the longer term, providing this additional service?
Absolutely. Well, the air ambulance operations are an expensive operation, but are funded through the generosity of people in the Hampshire and Isle of Wight region and also in the Thames Valley region. And it's only through their continued generosity that we'll be able to sustain this service. But it does make a huge difference in terms of the level of care that we can deliver to individuals. And of course, you never know when our services will be required.
Joe also mentioned in his report, we've got 2 helicopters involved, but only 1 doctor necessarily in the air at a time. What's that all about?
Well, the initial plans are that we have 1 doctor covering the entire South Central region who will be based on one of the 2 aircraft. It is a large area to cover. There is a lot of trauma that goes on in the area, so the aim will be to prioritise that doctor together with the air ambulance team to attend the most seriously ill and injured incidents. You've
been volunteering with basics as a doctor for a long time. Is this an extension of what you've been used to doing?
It is. It's similar principles in terms of going out and supporting the paramedics at the incident. But by being on a helicopter, we are able to provide a more efficient service in terms of being able to cover a much larger geographical area very quickly. So rather than doing it in a car-based scheme, which has operated on an ad hoc basis in the past, we're hoping now to have a more regular and reliable service based with the air ambulance.
Charles, we really wish you all the very best of luck with this new service. Thank you for coming into the studio tonight.
Thank you.